But this is the part where we go through and explain how individuals can obtain access to medical psilocybin. So it outlines how healthcare providers, how they would be able to write medical documents for patients seeking access to medical psilocybin, and also how patients with valid medical documents can obtain psilocybin from a license holder. So this section also outlines the regulations for personal production, which I know many people have asked about, essentially pertaining to how you might be able to grow or designate a grower.
We have to start to look at this in a far more regulated medicinal way. And I think that these regulations are exactly what's going to do that. And this is how we accomplish it, through legal means and through the government not being our grandparents and starting to be facilitators of what could be one of the most dramatic and dynamic new mental health tools available to us today.
And I just wanted to put it over to you. Under the new regulations, or these proposed regulations, how would an individual and a healthcare practitioner go about getting access to psilocybin?
Well, a healthcare practitioner would write a medical access document for their patient, and then their patient would be able to register that medical access document with a license holder to purchase psilocybin products. Or that patient could take their medical document and send it to the minister so that they could get a registration certificate to cultivate their own psilocybin mushrooms. It's used more with minors. The healthcare practitioner themselves could receive the psilocybin products rather than the person who's going to use them. And that, because cannabis, the way it's used medically, it tends to be more self-directed, without supervision and daily. I think we're going to see contrast from that in this system if it's implemented, in that the individuals who are involved are going to be using psilocybin infrequently and likely under supervision. It would be by the medical practitioner, the healthcare practitioner would write a medical access document for their patient, and then the patient would use that either to purchase psilocybin products, which would be delivered directly to them or to their healthcare practitioner, or they would register their medical document with Health Canada so that they could cultivate their own psilocybin mushrooms. And I'll also add that this system we're proposing is federal, and it would make it possible for these medical documents to be written, and it would make it possible for the products to be sold. However, the terms on which medical access would actually be given would depend from healthcare practitioner to healthcare practitioner in their professional judgment. And of course, some colleges would be free to either restrict or openly endorse this practice, and that would be up to the regulators in each province. And I think that's part of the beauty of this system, because like cannabis, it allows the various provincial colleges to control access by regulating their professionals.